Now, around the world, it seems countries are experiencing or are on the verge of a second wave of COVID-19 infections. South Korea has seen daily cases spike again in recent weeks, topping 300 last week as local transmissions spring up in clusters in the capital area and spread nationwide. Countries in Europe are also becoming nervous as the summer holiday season gives rise to a sudden surge. During the first wave, most healthcare systems around the world were overwhelmed with patients, and medical workers were critically understaffed and lacking in adequate equipment. Are we better prepared for a second wave, and how should we manage it? For this, today we connect with Dr. Kwon Sun-man, Professor and former Dean of Public Health at Seoul National University. It's great to see you this morning.
Good morning. Thank you.
We also connect with Dr. Marco Vincetti, Professor of Epidemiology and Public Health at the University of Modena and Boston University School of Public Health. Lovely to see you today.
Thank you for the invitation and good morning.
Good morning to you. It's very early in the morning in Italy, so thank you for joining us. And well, why don't we start with you, Dr. Kwon? So South Korea raised its level of social distancing protocol to 2.5 last week. But then this came after some speculation that it may actually be raised to level 3. So what do you think made the authorities decide on 2.5, and do you support that move?
Actually, I was opposed to the idea of increasing the level to level 3. Because for me, the evidence was not clear whether the current level, at that time level 2, is insufficient or not. Because not a long time ago, we raised the level from 1 to 2. So we didn't have enough time to evaluate whether the current level 2 is enough. And also, I thought that what is the major reason of these spikes? I think it is not just we have a lower level, but just people did not comply with these guidelines. And also, when you raise the level to a higher level like level 3, it has a huge impact on the economy. So in that sense, even the experts are divided that whether we should raise the level furthermore. So I think it's a bit of a hybrid, such that government finally decided to increase the level from 2 to 2.5 rather than 3.
I see. Well, Dr. Vincetti, Italy has been one of the worst hit countries in the world from the COVID-19 pandemic, but it still managed to contain the outbreak thanks to very early and very strict lockdown measures that the government only started easing in May. Now, a survey by Pew Research Center shows that most Italians approve of how the pandemic was dealt with, and many of them are they now have a higher level of economic confidence than most other nations that were surveyed. So how do you think Italy managed its response to the pandemic?
Yes, I am among the let's say, professors working in public health who supported this approach. So I think the approach by the government and by the national health system has been successful, very strong, very difficult to be taken. Now we are, let's say, happy, even if concerned about a possible second wave, by the fact that we were hit so strongly. The outbreak swept across the entire country, particularly the northern part of the country. I'm located in the University of Modena, which is in Emilia-Romagna region, one of the 3 regions with Lombardy and with Veneto that were hit really strongly by the pandemic. But the response was strong. The lockdown actually was very tight. We started the tight lockdown on the 8th of March. And for, let's say, 2 full months, it was really and total. It was so tight that nothing was possible apart from high level, very important professional activity, and of course, healthcare and so on. But now I think this heritage, we are really enjoying the good consequence of this approach. And this is why Italian people are substantially confident that this was a good approach. Actually, as an Italian, I must tell you that we were surprised, even ourselves, by the compliance of the population to this strong approach. Very, very hard, very difficult to stay home during the lockdown. But I think that this was extremely important if today we are one of the, so far, we don't know what is going to happen tomorrow, let's say, but so far now, for instance, today we have less than 1,000 cases. I'm talking about today, that is, today means actually yesterday. So we're talking about Monday, the 31st. Number of new cases decreased below 1,000. Is not really completed the curtailing of the outbreak, but we are rather satisfied also because the new cases are generally asymptomatic or symptomatic. So this makes really a lot of difference.
So really a great achievement seen in recent months, and we all remember how the Italians were singing from balconies during the lockdown period and making the best of things while social distancing. But while countries like Italy went into lockdown mode, but Professor Kwon, why is it difficult for countries like South Korea to impose a full lockdown like Italy did?
I think we are concerned about the potential negative impact on the economy and social activities. Because in Korea, compared to other OECD countries, the proportion of the self-employed and small business owners, that proportion is much higher than other countries. So when we have a more restrictive measures such as lockdown, Korean economy will be hit harder than other countries in OECD. And also it's a path dependency. So each country has its own paths of the different measures of the government policy as a response to COVID-19. Because Korea successfully responded to the COVID-19 at a very early stage, so successfully contained the spread of COVID-19. So we didn't have to do a lockdown. So at this stage, if you move to the very serious measures and lockdowns, mentally, it'll be very difficult for people to accept this. And as I mentioned earlier, the negative impact on the economy will be very serious, and it might have a negative impact on their health eventually. I'm talking about mental health, or suicide, some very disastrous health impacts. And also in terms of education, when the school is closed for longer and longer under this type of restrictive measures, it has a very serious impact on the human capital development, and there's increasing gap in the academic performance of children from different socioeconomic background. And so for various reasons, we should be very cautious whether we should increase the level to upward or not. It's not just a health perspective, but we should have a broader socioeconomic perspective when we make this type of decisions.
Right, and as you mentioned, from looking at it from a socio-economic perspective, Dr. Vincenti, in Italy, daily infections last month in August, they rose again above the 1,000 threshold. And this really led to fears of a second wave, especially with some 8.5 million students set to return to school. So how worrying is the current situation right now?
Well, we are aware of the issues just mentioned by my colleague about not just mental health, but also the needs for education, to have our school reopening. So this is really an issue, and this is why in 2 weeks the schools are going to open, unless something very now we can't foresee happen, but we hope not, of course. So we are aware there are risks in opening the schools, but we are committed to open again the schools. Of course, taking into consideration what we have learned. I think that Korea, I'm not telling this because I'm talking with a Korean television. Korea is a very good example. In Italy, Korea has a wonderful reputation in how you were able to tackle COVID-19. So, for instance, in contact tracing, using electronic device, electronic equipment, electronic applications to trace and to identify early contacts, asymptomatic cases, and so on. So this is a kind of example. Even, of course, our people, our cultures may have some differences, but this is something we have learned also from, let's say, Asiatic countries and Korea in particular. But I think that the perspective are not so sobering, so difficult, so concerning, because now we have a rather low number of cases. Those cases are generally in young people. This is a very different epidemiologic pattern compared with the previous pattern in spring, when particularly elderly people were affected. So, and now the infections, the severity of the disease, even in the same age groups, seems to be decreased. We don't know exactly why. There seems to be not an issue of virus mutation, so we don't know exactly the reasons. We are studying this issue. Everybody all over the world in the biomedical research is taking care of this issue, but we are facing a better situation. And we do believe, and we hope we are right, that we can afford reopening schools, taking in strict control, particularly, for instance, young people going to the discos. The issue in August were the travelers from abroad, travelers within Italy, and young people going to discos, and in some cases, some occupational environments. It was not an issue of population-based outbreak. This is why we are, let's say, optimistic, even if aware that something not so good may arise again.
Well, you mentioned the South Korean case, and Dr. Kwon, in March and April, of course, that's when the COVID-19 pandemic peaked here in Korea initially. And medical workers in the Korean city of Daegu were overwhelmed with COVID-19 patients. And it took a rather extraordinary effort to ramp up the healthcare system's capacity to handle the first wave here. But now we are facing ongoing strikes by resident and intern doctors who are opposed to the government's plans to boost the number of medical students, public health schools, and also introduce more public insurance coverage on telemedical services. So how will all of this really affect the nationwide response to the second wave that we're starting to face?
Well, I think it's a pity and it's a shame that the doctors are on a strike at this very critical moment, because we have an increasing number of cases and patients. That means that we need a more and more healthcare personnel. So this doctor strike may have a very harmful impact on the overall our capacity to respond to COVID-19. But the major issue here is that the government's announcement that it will increase the number of doctors, basically number of the admissions to the medical school to educate more doctors. But I think from a expert perspective, it is very legitimate that Korea has a serious shortage of doctors. I mean, the per capita number of doctors in Korea is one of the lowest in the OECD countries. That's the obvious, very objective statistics. But in the COVID-19 crisis, in this type of pandemic, it's very difficult for the private sector hospitals to treat the COVID-19 patients. So far, public hospitals in Korea treated more than 80% of the COVID-19 patients, although public hospitals account only for, less than 10% of all Korean hospitals. So a very small portion of these public hospitals treated the majority of COVID-19 patients. Then what will happen if this type of pandemic comes back? And it will come back. We need to compare. We need to prepare it, and we need to strengthen the capacity of public sector hospitals and public sector medical care. And okay, doctors, the hospitals can build more hospitals in the public sector, but it takes time, as you know. A long time to educate medical doctors, healthcare personnel. So if you do not start educating more doctors to work in the public sector, it will be very late, and it will be a serious mistake in the preparedness for the future pandemic. So it's quite legitimate to increase the number of doctors in Korea, and it's very sad that the doctors are against it. And they are on a strike at this very critical moment. It's a shame.
So really what's so important is that everyone comes together and works to the benefit of the public health, really, and not, vested interests, I suppose. Well, in Italy, Dr. Vincetti, Your health minister recently said that Italy doesn't require any additional lockdowns despite the recent surge of numbers that we've seen in the number of cases. And he said that Italy's system has become much stronger. Would you agree with that? And also, what do you think should be done to prevent a stronger second wave from happening in Italy and also neighbouring countries in continental Europe?
Yes, it's slightly more difficult for me to talk about Europe, let's say, even if, of course, we are a European country, well embedded into the European Union, but of course, way of life, habits, and so on are clearly somehow different across the different European countries. What I can tell you is that I share some concerns with my colleague. So in Italy, it was very difficult, the month of particularly March and April. It was really such a challenge for our health system, and we could hardly cope with the enormous difficulties because we had such a large number of patients admitted to the intensive care units, really an overwhelming number, and overcoming the possibility of our system. Now, I must tell you, the situation is really different. We have learned from that awful experience, such a difficult experience with health personnel really behaving as heroes in some cases. I teach, I perform research, so I'm not talking about myself, but I can tell you that there were many students, many nurses, many doctors who really gave us a wonderful example, in some cases paying a high personal toll to this epidemic. So what have we learned? We have learned how to perform better epidemiologic analysis. We are increasing the number of physicians in the departments of public health. We have increasing the number of students admitted to the medical schools. We are shortening the bureaucratic difficulties at the end of the degree, medical degree, or the nursing degree, in order to be hired by the hospitals and public health systems. We are the situation in Italy is, as far as I can understand by my colleague, is different. Almost all hospitals and all health departments in my region and in Italy, almost all are public. We have basically only a public system. There are some private hospitals, of course. Frequently they are good hospitals, but a very, very minor part of the national health system, which is based almost entirely on public institutions. And this makes a difference. I'm not talking, of course, I love our system. I also know the limitation of our system, but I do prefer this approach based on the public, even if, being public also means some, let's say, administrative difficulties. But in such a case, in front of this challenge, this threat, having a public health system and a rather large public health department network was really an asset. Was not enough. It was limited in front of it, but yes, very much needed. Yes.
Sure. Thank you very much. I'm afraid this is where we're going to have to wrap up the discussion. But as you both mentioned, the public response to this is so important. And of course, in dealing with this COVID-19 pandemic, the second wave, we can't forget the doctors in the first wave with their bandage, strewn faces. And we really need to support them, and they also need to be there for us again as we deal with this pandemic, the second wave of it. Well, that was Dr. Konsulman, Professor and former Dean of Public Health at Seoul National University, and Dr. Marco Vincetti, Professor of Epidemiology and Public Health at the University of Modena and at the Boston University School of Public Health. Thank you so much for joining us from Seoul and Modena.
Thank you.
Thank you to you. Thank you.
And to our viewers, thank you for watching. We'll be back at the same time tomorrow in Korea. Have a great day or evening wherever you are. Goodbye.